Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. So we have been discussing about neurological disorders in children and role of Panchakarma. So today we shall see about Basti. What is the role of Basti? As I told, in the modification we always go for Matra Basti. Now, Basti is the mainstay of treatment. The concept which I usually follow is that of the gut-brain axis. So, daily administration of Matra Basti to the child will going to nourish and modify and sensitize the gut-brain axis so that the CNS brain and CNS can be get modified or tapped. So, this achieves the mainstay of treatment. There will be Vata Vruddhi due to Dhatu Kshaya in case of neurological problems. Maybe acute problem, or that means maybe Margavaradajanya or maybe Dhatukshayaجanya. Now, as a result, there will be concomitant Kapha-Kshaya. Vata Vruddhi and Kapha-Kshaya is there. Vata is increased and Kapha is Kshaya. So, excitatory neurotransmitters are increased. Meanwhile, inhibitory neurotransmitters are more. Okay? Situation is like that. Excitatory neurotransmitters are increased, and relatively, because of that, inhibitory neurotransmitters are less. More and more amount of excitatory is working. Inhibitory is less working or not working at the cortex and spinal cord level. So now how Basti can alter this? Of course, Mustadi Irajayapana Basti with Mamsa Rasa or other Brahmana Dravya, so Vriksha drugs should be given because we want to increase the Kapha. A Brahmaniya Basti should be always given. Now, what I prefer is Matra Basti on daily basis. So, Matra Basti when it is given on the daily basis, one, it is very convenient and can be applied very safely, and it nourishes the Vatasthana, that is Pakvashya. Gradually there is modulation of the brain, gut-brain axis, which is a sthana of the Prana Vata and Udana Vata. Okay, so Matra Basti can be given by Kshira Balataila, Prasarani Taila, Sahacharadi Taila, Kalyanaka Grita at times, in for example, patient of autism, Brahmi Grita, etc. Usually you start with 5 to 10 ml. Okay, any time of the day it is given, no problem. So this is quite convenient for the patient. And some of the unwanted concern, like it will be habituated, like that. So far in my practice, I have not seen such cases where the patient is habituated for Matra Basti देने के बाद ही जो है वो लैट्रिन पास करेगा, ऐसे habit हो गया, ऐसा कुछ नहीं, because already there are so many problems in neurological problems, issues. Now, this is about the Basti. Now, what is the role of Medhya drugs? Medhya Vayasthavana drugs in the form of the Kshirapaka I used to give. Okay, Medhyasana drugs and Vayasthavana drugs in the form of Kshirapaka is best. So in the Kshirapaka you can accommodate so many drugs, as many as drugs possible. Medhya drugs helps in changing the brain environment and strengthens the brain neurons. Strengthening may be in the form of changing the excitability, increasing the inhibitory neurotransmitters, creation of new synapses in the brain or circuits in the brain, or strengthening the cholinergic system. That is adrenergic. Adrenergic is always excitatory, cholinergic is always inhibitory. So what are the drugs which can be used? Ashwagandha, Vidari, Shatavari, Guduchi, Yashtimadu, Punarnama, etc. drugs can be mixed together. And Vayasthapana drug. Vayasthapana drugs, Vayu ko वापस स्थापन करने वाला. Now, degenerative disorders of the brain leading to neurological problem, where cell death has been taken. Now that cell has to be regenerated. Okay, the lifespan of that particular neuron should be increased. Okay, that is Vayasthapana drugs. It needs to increase and sustain the Vaya of the child and also cell. This is what I told Pattabandhana method. It is nothing but a modification of the Upanaha Sneha, and this is the picture. Okay, so same drugs which are used for the Upanaha Sveda can be used, and this is how it is done. Okay. Now, Nasya in neurological disorders. In neurological disorders, to some extent, Nasya is also quite beneficial. Marsha Nasya, it is quite difficult to give in children. So, Pratimarsha Nasya is definitely given. Okay, this is very good for the disorder of the child. Cranial nerve stimulation also can be achieved by this. Kshirabala 101 or some other, even Tila Taila is at times, Yashtimadu Taila is also quite beneficial. Now, there are some of the drugs like Nidrajana drugs. At times, even the Nidrajana drugs are also quite useful to induce the sleep when the child is more irritative. Mild sedative drugs are also quite useful to combat the hypertonicity. Cola, Badara, Tagara, etc. are some of the drugs which can be used. Certain dopamine containing drugs like Apikachu and Masha can be also used. Now there are different drugs which carries a neuron regenerating property. Whether it is regeneration is possible or not according to contemporary science, different issue. But according to us, there is no such reference that neurons are different and they cannot be regenerated like this. There is no reference. So some of the drugs which are quite having neuron regenerating quality, maybe like Bala, Prasarani, Kopilu, Jatamamsi, Vacha, Masha, Kapikachu, Yeshtimadu can be used in the different forms. Vedana Stapana, if the sensory issues are there, Vedana refers to sensation. Okay, if the Vedana is lost, then again we have to re-establish the Vedana. Sensory sensation should be re-established. That is called as Vedana Stapana drugs. Okay, so useful in sensory problems, they restore the sensation. Bahya Sneha methods are quite useful. Prasarana is a Vedana Stapana drug. Okay, it's quite good for the sensory issues. Other drugs like Katfala, Padmaka, Mocharasa, Shirisha, Shoka, Prasarani, these are all the Vedana Stapana drugs which can be used. If there is more and more motor problems are there, then yes, motor problems are because of Gati of the Vata, so Anulomana drugs are quite useful. Some of the Samnya Stapana drugs like Jatamansi, Hingu, Kaitava, Vacha, Choraka and Katukarovain can be also used. Vayastapana drugs already we have discussed. And these are all the prescription for different disorders related to neurological problem. With this, we conclude this series of talk related to role of Panchakarma in neurological disorders of children. Thank you very much.